All right, we are jumping right into the fire today. This isn't your typical lecture. We're simulating a full, high-stakes ER shift. The focus? Two systems that can go wrong in a hurry, neurologic and temperature regulation. Your job is to spot the cues, because in these cases, that can change everything. Let's get started.
Okay, you're officially on the clock. You've got 4 patients headed your way, and every single one is an emergency. You have to be the one to see the signs, figure out the priority, and know what to do next. Ready? Let's go.
And here we go. First patient is rolling in, a 10-week-old infant, Elliot Flynn.
So you walk in, and mom is right there, clearly worried. She tells you, he's just not himself. He's fussy, he's throwing up, he won't eat, and she says she thinks his head looks bigger. Right there, those are your first clues. What's your gut telling you? You get a set of vitals. And here's where it gets tricky. Take a look. For a baby this age, these numbers don't really set off alarm bells, do they? A heart rate of 145, respirations at 40, this could easily fool you. And that's exactly why your physical assessment is everything. In your hands-on exam tells the real story. You feel the soft spot on his head, the fontanelle, and it's bulging. You measure his head circumference, and it's up. You see those sun-setting eyes, with the whites showing above the iris. And then you hear it, that high-pitched, piercing cry. Put it all together. What is this screaming at you? You got it. It's hydrocephalus. There's way too much cerebral spinal fluid building up, basically turning that tiny skull into a pressure cooker. Every single sign you just saw is a classic red flag for dangerously high intracranial pressure in a baby. So what's the plan? What are you doing right now? Neurosurgery is on the way, but your job is all about monitoring. You're doing constant neuro checks, you're measuring that head, and later you'll be watching that post-op shunt like a hawk for any signs of failure or infection. No time for a break. The ambulance bay doors fly open. Trauma room now. Patient is Jason Miller, he's 29. EMS gives you the quick and dirty report. Motorcycle crash. He was unconscious at the scene, and now he's awake but not making any sense. Instantly, your brain should be yelling, head injury. You get him on the monitor and, whoa, look at this. Heart rate is 52, respirations are only 10, and his blood pressure is 180/60. Look at those 3 numbers together. What is this triad telling you? This is a massive, screaming red flag. This is Cushing's triad. And let me tell you, it's one of the most terrifying things you can see on a monitor. It's a late sign that the pressure in a skull is so high, it's actually starting to crush the brainstem. This is a 5-alarm emergency. And your neuro exam just confirms the nightmare. He's confused, his pupils are blown, he's complaining of a killer headache, and then he starts vomiting. You can literally see his level of consciousness starting to slip away. He's got a major TBI with brain swelling. Okay, time to act. The orders are flying in. You get the head of the bed up to 30 degrees. You're hanging IV mannitol to pull that fluid off the brain. You're getting oxygen on him, and you are doing neuro checks every few minutes. And let's talk about that first step, because it sounds almost too simple. Elevate the head of the bed. Why? It's all about gravity. You're helping the blood drain out of the head, which directly lowers that dangerous pressure. It's a small move with a massive impact. Okay, pivot. Another call comes in. An elderly man, Harold Davis, 76 years old. He was found passed out in a parked car on a blazing hot day. You get him hooked up and just look at these numbers. A core temperature of 105.6 degrees Fahrenheit. His heart is racing at 122, trying to compensate, and his blood pressure has completely bottomed out. His body's internal thermostat has failed. This is severe heat stroke. For this patient, your number one priority is one word: speed. You have to initiate rapid cooling. Now. Get his clothes off, cover him in cooling blankets, get ice packs to his groin and armpits, start IV fluids, and get the cardiac monitor on. Every single minute his body stays this hot, his brain and organs are literally cooking. And you're not done yet. Your final patient is here. Angela Price, 48, found outside after a night in freezing temperatures. The total opposite of your last patient. Her vitals tell a completely different story. Her core temp is down to 92. Her heart rate is slow at 48. Her blood pressure is low. Everything is slow, cold, and shutting down. So what's your intervention here? Is it the same game plan? Absolutely not. The key word here, and I want you to burn this into your brain, is gradual.
You have to rewarm her, but you have to do it slowly with warming blankets and warmed IV fluids. Why? Because a cold heart is incredibly irritable. If you warm her up too fast, you can throw her into a deadly arrhythmia. The phrase, "they die warm," is a real thing.
And this right here is the critical lesson. It's the tale of two emergencies. For hyperthermia, you race to cool them down. Fast is your friend. For hypothermia, you have to go slow and steady to protect that heart. Two opposite problems, two completely opposite approaches.
So, let's debrief the shift. 4 patients. The first two, hydrocephalus and TBI, were all about pressure building up inside the skull. The second two, hyperthermia and hypothermia, were about the body's entire temperature system going haywire. Each one required you to spot very different cues and act fast.
So when you boil it all down, what's the big takeaway? It always comes back to this. Your job is to see the signs early, stabilize the ABCs, airway, breathing, circulation, and then intervene to stop things from getting worse. That's the heart of emergency nursing, right there.
And just like that, your shift is over. You made it. But the real question is, when you walk through those doors for your next shift, are you going to be ready? Are you going to be the one who sees the signs when it counts?